Hi, good morning, everyone. Good evening, good afternoon, and good late evening for a lot of other countries who are joining in. We have crossed 100 and we are on 103 session, 103rd session on CMAAO, International Weekly Meeting. And COVID is not yet over. So in the morning when I sent the message in the group for joining this meeting, we have already two people down with the COVID since they were traveling. And so I think we still have a lot of countries suffering from COVID, and we do not know what's going on in 2022. But I think the precautions is something which we all need to take. I don't know about other countries which people will discuss right now, but I have seen in India that people have stopped wearing masks, which is a big concern. And not only they have stopped wearing masks, but the social distancing, all the precautions which we used to take has gone off. It seems like that the COVID was never there. I hope we are right and COVID should not be there, but we never know what's going on. So we will start our meeting today, and we have Dr. Russell here, who has been infected. So thank you, Dr. Russell, for joining in. Let's start the meeting today. So Dr. Russell, can you please talk first, like before we start, what happened and how mild it is or how severe it is?
Well, I was thinking of Monica all the time because you see, I had all the three injections, and I was in Portugal, and Australia has this rule that you have to have another test before coming back. So I had the test in Heathrow Airport. I had a PCR done, and I was negative. Anyhow, I came back here, and I think I took this flight from London to Darwin, 18.5 hours. It was non-stop. And I presumed everyone on that flight must have been tested, so they should be normal. But then we got off in Darwin for refueling and back again for 4 hours. And in this time, I noticed that it became a local flight, and so I think a lot of people, not a lot, but a few people came in who didn't need to be tested because they were traveling within Australia. And I suspect, because I came back on Monday, and on Wednesday I started getting some pain, and then I tested positive. But fortunately, I think the vaccines and all this stuff definitely helped, because I had one day and then a bit of cough, and I just started myself on some erythromycin and some anti-inflammatory and antihistamines and all that, and seemed to got around it. So I think yesterday it was negative, or day before yesterday it was negative. So I think I'm hoping that Monica got the hybrid what you talked about, hybrid immunization, isn't it? The combination of both, right? And now, yesterday, for all of you, Australia has approved now the fourth vaccine. So yesterday it came out that the TAGI have brought in the fourth dose. For a start, it's for everyone who's above 65 and all the immunocompromised and so forth. So, and I guess that is also trying to prevent the, or at least they anticipate the winter, because we're going into winter here in the next 2 months. And the other thing is that with the Omicron, the variant, it appears that we are getting a good dose of that now at the moment. We had 30,000, I think, yesterday in Sydney. So that's become an issue. But of course, I have to say that I was a bit tired and had pain and all that for 1 day or 2 days, and it's been relatively mild. Saurabh, thank you very much for asking me. But I think there's definitely what I can see is the vaccine definitely helped me. If I
So
didn't
Russell,
have
what was the maximum fever you got? Or did you got any fever?
no, I didn't get fever too. I
Okay.
don't even think I got fever, but I was having 1 day terrible body pain and probably had some temperature. I didn't even bother to take it. I couldn't get up. I was just knocked out because I was perfectly all right on Tuesday. Went out and went away. And then the third day, so it was probably, I suspect, I don't know, Monica may know better when, because I don't know, they say 3 days before. Is that right, Monica? I'm not sure when this could have happened.
It's very quick from the time of an infection to the time that you have symptoms, and it is days, just a few days.
Is it? So that's why I suspect that it happened in that period of time that others gotten on that flight. So I don't know if there was someone with the infection on the flight. I don't know. But
What variant
I
was it?
presume that everyone had to take, you couldn't get on the flight if we didn't have a PCR and a vaccine. You see, here in Australia, if you don't have a vaccine, you can't leave the country. So we had to, when I left, I had to have a PCR and I had to have a vaccine certificate. And of course, coming back, the declaration and all. But I didn't have, I was 5 days in Portugal and then I was in Scotland for 3 days, 2 days, 3 days. I was perfectly all right, but it's only on the third day on coming back here, this happened. So if what Monica is saying, I think it should be that I got infected in the journey. It was a long journey, 34, nearly 30 hours.
Usually, Russell, when we used to travel for that long and we used to come back in the normal era, we used to say it's a travel fatigue.
Yes, I know. I think this was a combination of both. But so that's a. But I did feel rigors and all that for that day. You see, I don't normally get that. But also trying to avoid too many places. I took this new flight which goes for 18 and a half hours between Darwin and London. Just avoid going through other places. I
Yeah.
took long flight. I thought I was really comfortable because they tested you and everyone were tested. But I didn't realize that the last 4 hours was also people who were not tested on that flight. So that could be, or maybe I got it early. I don't know. But anyhow, I never had it now till for 2 years we managed. And now, of course, the first trip out, I just tried to check whether, because I have to come to India, I have to go to Europe in May. So I was just testing to see if this will work. And so and I was, last time Dr. Chong came here and told me how he went to France and he escaped and came back. So I thought I was also going to escape, but I got it. Anyhow, I can only say that the vaccine must have helped me a lot.
I'm sure vaccination is very important.
Very important. Definitely.
So I think a lot of questions do come to us, at least, that if we are vaccinated and you're still getting infected, then why to get vaccination?
Yeah, because
so the answer
that's
lies in your words. Because the vaccination will not prevent, but it will make it milder. It will not let it spread inside your body, and it will make sure that you come out safe. So vaccination is not something which can restrict virus to get in, but it will definitely not lead to any major issues.
I had very bad only for 1 day, which
that's okay. Great. So Russell, since you're speaking, why don't you give an update of your country also?
Well, that's what I was just saying. Australia, the issue here is that we are having a surge in the second variant of the Omicron, the 2, isn't it? The one which is about 25 or I don't know. I just was listening to Dr. Norman Swan talking, and it's certainly more infectious, but it hasn't shown. Both Dr. Swan and the another infectious disease, they've not been able to show an increase in virility of severity as per the number of admission to hospitals and so forth, it's still below 1%, they said. So which is only increasing the number of cases. Sydney had a large number, 30,000 or something yesterday, but it hasn't translated to hospitalizations. So we're still comfortably on in terms of hospital admission, in terms of ICU, in terms of all those parameters. But taking this into account, the ATAGI, which is the committee that looks at this, has yesterday come out with their recommendations that we will have the fourth vaccine started straight away for the first group of people, which are people above 65 and all those who are immunocompromised, and also for people working in nursing homes and people are working in the nursing homes and aged care facilities. So that's what has come yesterday. So that's the fourth dose. I think 4 months to 6 months from the last one, they're asking you to have it for. But having said that, I was in Dundee, at the University of Dundee with the AMI, and they told me that France is bringing out a rule that irrespective of your immunization, when you come in, you need to have had your immunization in 6 months. Okay, so which will force some of us, if you want to travel, then you'll need to take a fourth one if you've already had your third. Like I had mine in January, so in July, if I'm going to travel, I will need, as per the new rules that are coming out, that you will need to have had immunization in the last 6 months. So that was what I heard there, and I'm sure if France brings it, most of the European Union will bring that same type of rule, I presume. Yeah.
Thank you so much.
Yeah. Thank you all. Thank you.
Do we have Pakistan here? Yeah, Dr. Salma, can you please update on Pakistan? Can we have an update from Pakistan? Dr. Salma, are you there?
Yeah. Can you hear me?
Yeah, we can hear you now.
Things over here, alhamdulillah, are good because we have about 8,165 active cases. So every day the new cases vary from about 170 to 250. And in the last 24 hours, 4 people have died. So that makes the count of our total deceased since COVID-19 started to 30,340. Our fully vaccinated people are 10 crore and partially vaccinated are also about 11 crore. So things here are good, although I'm really surprised why they're good because I see unmasked people everywhere. The vaccination that's been done is in full swing, that is better, but there is no social distancing and no masking in the laymen, in bazaars and in markets. So that is it for Pakistan now, and they have started vaccinating teenagers starting from 15 onwards, and for little children, they have not started it so far. That's it. Thank you.
Thank you, Dr. Salma, for the update.
Saurabh, I just wanted to make a comment.
Can I have an update from Dr. Murray? Sure, go ahead.
Oh, I just wanted to talk about something that I placed in the chat. And it was talking about those who were unimmunized and who got infected with the Omicron BA1 and we can say that right now what is in the world is the BA1 or the BA2 variant. And what it shows is that, that the BA1 variant is an extremely potent immune escape variant that shows little cross-reactivity with other earlier variants. Therefore, those who are unvaccinated, but they get the infection with BA1 without any prior SARS-CoV-2 infection may not be sufficiently protected against infection with a variant other than Omicron BA1. So if you have hybrid immunity, as Dr. Russell had mentioned earlier, you get the benefit of the immunity to BA1, but also the cross immunity to the other variants from immunization. So you don't know how the pandemic is going to evolve and how it'll have its tail when we get out of this. So it is important to get the immunity the best way you can. Obviously not to get infected, but the vaccination and showing the power of the vaccinations.
Mm-hmm.
Thank you. Dr. Marie from Japan.
Yes, thank you very much. I'm sorry I'm not seeing you all recently, but we are experiencing the 6th wave in Japan, but it's slowly fading right now. But unfortunately, the BA2 is kind of controlling the 7th wave, and the Okinawa Prefecture has been reported some kind of the cluster with BA2. So may I ask Dr. Monica about how is the cross reaction with BA1 and BA2? If the person got BA1, is it possible to have BA2 too, or fully immunized against BA2?
If you give me a minute, let me see if I can find some information regarding that question, which I think is very important.
Thank you.
Meanwhile, I'm sharing all the graphs of each countries, just to have a picture of how it looks like. So this is Japan with the 4th wave. Anyone else has any questions before we move with the other countries? And yes, Dr. Angelica.
Morning. I think this is a very interesting topic or discussion that we now have. I have recently seen one person, and it's a young person who had Omicron in beginning of January, was positive on a PCR from the lab, and coming in last week, or this past week, with symptoms, again tested positive with a rapid test, and clinically have the symptoms. So I also, I thought a lot about this because it doesn't make sense. And this leads to Marie's question, and I don't think there's data on this. And this is the first person that I have encountered. So, either something was wrong and false positive, or she had both infections, or twice Omicron. Although she didn't have a temperature and a tachycardia that we normally see with the B2 variant. So I don't know. It's very difficult, and I'm worried that at some stage the PCR or the rapid test might not pick up that easily a new variant. That's the other problem that I'm worried about. And again, I think we put a lot of value on a PCR as a preventative tool, and I don't think it can really be used as a preventative tool. And I think that's why Russell, thought everyone is negative because I had the PCR. That's a false sense of security. I think we really need to look at these type of things because that's valid questions. Thanks.
I wanted just to follow up. So I did post a link on the chat to show that it is possible to get a BA2 infection following a BA1 infection. And yet it is possible that infection with BA1 also provides protection against reinfection against BA2. So I think we just don't have enough data right now to be able to understand the relationship of how much protection there is and whether sequential infections can occur.
Thank you very much, Dr. Monica.
Thank you. So, can we have an update from South Africa?
Good morning, Saurabh.
Good morning.
In South Africa, last 24 hours, we have 1,560 new cases. Out of that, 7 deaths within 24 hours. So far, we have tested positive 3.7 million. And our total death till last 24 hours, 99,939. And active cases at the moment is 13,836. Our testing positive rate is 6.2 for the last week from 13th of March to 19th of March. And our recovery rate is improved now 96.9, almost 97. Hospitalization around the country, public and private hospitals, 1,971 cases was admitted last 24 hours. ICU occupied 192 patients, 62 patients from them was ventilated. And our vaccination is 33.3 million so far, administrative dose. The new things is PCR testing requirement for traveling is no more required. Only the vaccination certificate will be enough to produce while you are traveling. And mask, indoor mask is still on implementation, but outdoor mask is taken away. Social distance 1.5 meter to now 1 meter. And thank you, sir.
Thank you. Dr. Muzukwa, you want to add something?
Good morning to you all. Thanks for this meeting. Just that with the adult population being the 60 years and above, we're still sitting at around 70% coverage there. And the other group, 50 years and above, sitting at around 60 or so, 60%. Then the younger group between 18 and 34 years of age, we're sitting at around 35% coverage. I think that's where we're still lagging behind. But also there is a concern in the country that the vaccine confidence is very low. We at this point in time do not have much uptake of the vaccine. Nevertheless, we're still having people coming in, and you know, there've been pressure on government to change strategy in terms of how they bring back the confidence, and also engage, do some studies into understanding why you know, there's hesitance still. What are the real issues on the ground? I think that's where we are at the moment. Regarding the vaccination again, the government has introduced the heterologous booster for those who have had healthcare workers, for example, in the country has had already 2 Johnson & Johnson vaccines, and they are now and can go for a heterologous vaccine if they wish so. And same applies with Pfizer or Community. They can still those who had the Pfizer can go for heterologous vaccine. Pfizer, it's about 90 days between the last dose or full dose, because you get about 2 doses there. So then 90 days after that, you are due for a booster. and some of our people have gone for boosters. And same applies with in South Africa, with Johnson & Johnson, you get about 1 dose. I know there's a debate whether we should go for 2 doses as the primary dose. But so far, the official schedule is 1 dose. Then that is followed by, after 60 days, followed by a booster of J&J, or you can go for a Comirnaty. So I think that's only what I wanted to add. Thank you so much.
Thank you. Any comments from Dr. Angelica again?
No, not really, except that the non-pharmaceutical interventions should not be abandoned, especially indoors. In a country like South Africa, we've got a vast outdoors, and even if it's winter coming, and I think it's the same in Australia, the temperatures never really get that low, so people are still outdoors. So there I don't have a problem, but indoors I think it's going to bite us. The churches and the schools, where you now can have more people, and the onus will now be on the churches and sports stadiums to make sure people are have proper vaccination passports. I just think that government in a way is not doing their responsibility. They have got a responsibility as well. So they put all the responsibility back into the citizens and into institutions to make sure, and I don't think that's right. And then the second part is we don't hear anything about what governments are doing regarding the sanitation and ventilation, and I keep on bringing this in because again, as winter is coming and people are going back full-time to work, we know that especially in South Africa, and I think it's the same in India and a lot of other countries, the ventilation in public sector buildings are poor. Mostly, I'm not, with this, I'm not excluding the private sector, but nothing is done. And a part of this viral infection is airborne. So I think it's going to bite us. I don't think going forward that we really, in the end of the day, going to get ourselves vaccinated out of pandemic. It's much more than vaccines. It is, again, the non-pharmaceutical and the understanding and the come to the party, not only putting the onus on the public, but the various governments also have a responsibility, and we do not hold them accountable to that. Thanks.
Thank you. I also see Taiwan here. Can we have an update from Taiwan? Can we have an update from Taiwan? Can you please unmute yourselves?
Yeah. Do you hear me?
Yeah, we can hear you.
Okay. This is Dr. Deng from Taiwan. Taiwan actually does not have much difference. I mean, compared with all of the policy and the practical situation here. But now our government start to reduce so-called the quarantine days for any foreigner to enter this country. We used to regulate that everyone has to be isolated for quarantine for about 2 weeks. But now, start from 10 days ago, it's reduced to 10 days. Hopefully that I mean, they basically they like to review, if we can move down step by step. For example, maybe 1 week late, 1 month later, maybe we can reduce down to 7 days or 5 days, and then eventually to to open the border, completely. But for the last week, we have some, very limited cluster that maybe, around some of the very, some families or some very small manufacturing facilities. For example, yesterday we have more like 14 or 15 new cases, something like that. But basically now, we still have so-called quite regular lifestyle here. But to wearing a facial mask is still required to get into the public, public realm, or to when you're traveling in the like a metro bus or subway, something like that. So, but when you have your mask on, but when you get into any restaurant, you need to take it off, right, before getting into so-called to have a dinner or lunch together with your friend, or or different peoples. Okay, that is which is the current situation. For any patient coming into the hospital, if the patient is supposed to be admitted for surgery or medical care, to be admitted into the hospital, they are required to do the PCR. They are required to do the PCR to make sure that is no any active infections. No infection will be getting into the hospital. So, and any patient coming to the emergency room, if he gets fever or some symptom sign may be linked with the COVID, needs to be tested by PCR first, which take somewhere about 45 minutes to get the answer. That is the current situation right now.
Thank you. Dr. Monica? Everybody's waiting for your update now.
Would you be able to allow me to share my screen?
Sure.
So I think this is the common theme of what we're talking about. We want to drive away with COVID remaining in our rearview mirror, not knowing if it's going to overtake us, and then again, will be in our front view. If you look at the Johns Hopkins website, in the 7-day average, we're seeing an increase in cases. However, if you look at the CDC website for today's last 24 hours, the number of cases has come down, the deaths have come down, hospitalizations have come down, and 81.7% have received at least one dose of the vaccine, which we know is not protective. We're talking about BA1 and BA2. This is looking at genomic sequencing between March 13th and March 19th, which is the most recent data that I could find. And what you can see is that BA1 is about 57% and BA2 is 35%. So if infected, you still don't know which variant you have. Looking at the sewer surveillance, looking at shedding of viral in our sewer system, you can see that the reporting is spotty across the country. And in the state of Wisconsin, which is where I am, you can see in the southeast corner, you see a red dot, which is showing a 1,000% or more increase in the 15 RNA, and as showing at least a 15% change. And so that's the region that I am in. Where I am right now, people are not masking uniformly. You will go into a store and you'll see some people wearing a mask. And social distancing is partially present. It depends on where you shop. It depends on where you dine. So vaccination, as I was alluding to earlier, still is very important. Here you can see the efficacy of a third dose in the Pfizer vaccine. This was a study that was published on March 23rd, included 10,000 or more people who were 16 and older, who received 2 doses plus placebo versus 3 doses of the immunization. And on the y-axis, you can see the cumulative incidence of infection and days after dose 3. And you can see that the incidence of infection much higher in those with placebo compared to those who had received the immunization, and showed 95% efficacy for breakthrough infections. What else do we know about patients? I like to talk a little bit about surveillance, a little bit about immunizations. Also like to talk a little bit now about long COVID, because this is what we are going to be seeing clinically. And this was a really elegant study published March 21st in the Lancet Diabetes Endocrinology. And what it is showing is diabetes, anti-hyperglycemic medication use, and composite outcome, looking at those who were not hospitalized, or those who required intensive care with COVID-19 infection. And what you're seeing is that there is an increase or excess burden per 1,000 people at 12 months in all of these parameters, more so in those patients who had received intensive care use. And you can see the hazard ratios here in this middle graph. And you can see that the highest was those for anti-hyperglycemic use and those who received intensive care a year later after infection. So the burden of prior COVID infection and the long-term sequelae are yet to still be seen. And this is what we have seen so far. A topic I've not brought up before was looking at the response to scientists or healthcare professionals during the pandemic. At the beginning of the pandemic, we all saw videos of, I think it was in Italy, where you saw tenants in apartment buildings standing in their balconies, and they were clapping and they were singing in praise of those in the healthcare field. Well, we know that that sentiment was not held by everybody and actually dwindled during the pandemic as the pandemic fatigue set in. So this was published in Science. And what you see here is the responses to a survey of 510 researchers. 38% of these researchers, and these were researchers that were involved in COVID research, and 38% or perceived to have been in COVID research, and 38% reported at least one kind of harassment, including 108 respondents who said that they received personal insults. Personal insults and attacks on people's competence or integrity were most often reported. Threats of violence, doxing, and unwanted visits were far less common. So there was a morbidity in terms of the reputation and the thought towards researchers or healthcare professionals. Further along in that article, views that drew vitriol, scientists who publicly advocated hotly debated positions on COVID-19 received the most harassment, the survey suggests. These correlations could have different explanations. The stances themselves could drive the abuse. For example, prominent scientists may receive both abuse and advocate for certain positions more often. So speaking out for not treating with ivermectin, you can see was a really strong degree of association, or medium here. Natural origin of the virus being most likely, vaccine passports or mandates, and you can see all these hot topics listed down on the left. So in my state on Wednesday, our Governor Tony Evers, he's a Democrat, signed a bill into law that makes threatening a healthcare worker a felony. Under the amended law, threats against a healthcare provider will be similar to any other special circumstance batteries which involve bodily harm and are punished more severely when the victim or perpetrator has a particularly professional status. In the state of Wisconsin, for example, battery against a firefighter or juror has more serious consequences, as do batteries perpetrated by people in prison or jail. According to Wisconsin law, a felony is a crime that could result in jail term of 1 year or longer. So that's all I wanted to give as a weekly update. Thank you.
Thank you. That was
Thanks,
very...
Dr. Monica. Anybody has a question? So just wanted to
Thank you, Dr. Monica, giving.
Go ahead.
Yeah.
You want to ask anything, Dr. Akhtar?
Yeah, thank you, Dr. Monica. That's excellent data you have shown us, the healthcare worker getting threat. I didn't have any idea on that, but that is true. Even South Africa, doctors are getting abused. Anti-vaccines are abusing doctors. In fact, they are saying it's a drug company manufacturing virus, is a man-made virus, and it's not a real virus. So it's still that concepts are going on. Thank you. Thank you for that update.
Yes, thank you.
Thank you. Meanwhile, just to give an update from India, we have seen about 1,600 new cases in the last 24 hours. Mumbai has seen no admissions, so it was zero since yesterday. There were 4,100 deaths in single day. The total cases have been declined by 16,741. Total death in the country is now just over 500,000. India has seen a total 2,500 discharge in 24 hours. Mumbai did not report any hospitalization, and most of the COVID restrictions will be off from March 31st, which is the financial year closing, and the mask rule will stay. So it's only the masking which will be a COVID protocol, which will be there, but all other rules and restrictions will be over. The international travel will be open smoothly. Everything will else, like schools, colleges, everything will become normal. So that was a quick update from the Indian side. We are early for the meeting close today. So if there is any, I can see smiles on Dr. Monica's face. She can sleep early today on Friday night. So if there is no other updates or no other person wants to speak on it, we will close the meeting. Any guest over here would like to give an update who's from a medical side can do that. I see some people from Singapore and Malaysia. If they want to make some comments or ask any questions, please feel free. Otherwise, we close the session. Okay, let's not take away smiles from Dr. Monica's face. So with this note, we will close the meeting today early. This is the first time we are closing the meeting well on time. So thank you everyone for joining in, and see you next week again. Just for an important update, on 9th, which is the next week, we have a very important speaker which Dr. Akhtar has brought in. So please, we will send the invite shortly after that. He's from South Africa, a scientist from South Africa.
Thank you.
Thank you, everyone.
Thank you.
Thank you.
Thank you
so much.